Alhamdulillah, wassalatu wassalamu ala rasulillah. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to our class on Save One and Save Humanity by Ariqat. I welcome you all again for the fourth class. Today we're going to start a topic on basic trauma life support. So we finished our 3 parts on basic life support and starting a new 3-part course on basic trauma life support. I'm Nabil Abdul Rahim, and along with me are my friends and colleagues, Dr. Zishan Ghani, Dr. Noordin, and Dr. Vikas Ahmed. All of us are emergency physicians, and we are here to teach on the basics of managing a trauma case. And so we refresh our intentions again. We go by the ayah of the Quran, وَمَنْ أَحْيَاهَا كَفَأَنَّمَا أَحْيَا النَّاسَ جَمِيعًا. And whoever saves one life, it is as if he had saved the mankind entirely. Also, the Prophet ﷺ mentioned that whoever alleviates the hardship of someone in distress, Allah will alleviate his hardship in the worldly life and the hereafter. This hadith is from Sahih Muslim. So it's a great honor that we get if we know the right thing to do to save someone. And I hope that all of us, we get an opportunity to save someone's life, and we do that purely for the sake of Allah. So this course consists of 3 parts, as we spoke earlier on. It's basic life support, basic trauma life support, and environmental emergencies and poisoning. So now we're going to start with the second part of the course, that is the basic trauma life support. So today's objectives are, the first thing, we will refresh through our quiz answers, which I've sent in the groups. And then we will talk about the introduction to BTLS. We speak a little bit about jaw thrust, neck immobilization, hemorrhage control, and then finally, what's our plan for the next class, inshallah. So we'll start with the quiz answers. This was prepared, the quiz questions were prepared by Dr. Noordin. Again, he's caught up with some important work today and he's not able to join us at the moment. So on his behalf, Dr. Zishan will discuss the question answers. Just a quick whiz through the questions which we sent and what are the answers for them. So Dr. Zishan, can you take over?
Yeah, Assalamu alaikum warahmatullah, bismillah ar-Rahman yes, so Alhamdulillah, the good thing is a lot of people have shown interest in the short quiz, and most of the people have answered correctly. So we'll just go through the quiz quickly before we start the next session. Okay.
All right.
Yeah. Yeah, can you see my screen, Nabil?
Yeah, I can, yeah.
Okay. So the first question was, you rescue a 5-year-old boy from drowning in the pool. When will you call the ambulance? First option is, will you do 1 minute of CPR as soon as you rescue the child from the pool and found out to be unresponsive? After few rescue breaths and chest compression, and when you see after several minutes CPR, there's no response. Now remember, these questions, they try to put you in the scenario of the person. So you have to think practically. Okay. Now, what will you do? Will you start doing CPR immediately? Will you give a few rescue breaths and chest compressions? Or when you see after several minutes CPR, there's no response. So remember, if you are alone and you rescue a child, what you will do is you will rescue a child from the pool. And when you see the child is unresponsive, then you will call for help. Remember, you have to see the child see the child is responding or not, talking or not, breathing or not. Is it easy? Okay. And if he's unresponsive, if you're alone, you have to call help first and then you proceed with everything else. Remember, if you're doing CPR chest compression, there's no one else to help you. You will be alone in doing all of this. You won't have anyone to help you. Okay, so the answer will be as soon as you rescue the child from pool and found out to be unresponsive. So 84% have answered the correct question. Okay. Yeah, remember DRS, ABCD, danger, response, send for help. Okay, that's how it goes. Next question. In an unresponsive child, where will you check for the pulse? Inner aspect of wrist. Remember, wrist is a very small area. Left side of neck, again, in a child, it's a very small area. Pulse check not needed in the kids. No, you have to check the pulse in the kids. Okay. The correct answer will be inner aspect of the arm. This was answered correctly by 84% of the people. Remember, when you see a child's arm, this is where you'll see the artery, you'll be able to feel the artery properly. Wrist is very small, the neck is very small, but here is where, if you have a child at home, you can check. Put you in a small babies on, check here, you will be able to feel the pulse properly. Imagine no pulse or pulse less than 60. That means if you check for 10 seconds, you should be able to get 6 beats. If it's less than 6 beats, if it's 5 beats, it means it's very less. Okay. Okay, third question. You find an old woman unresponsive in bed. You call for help. Now you know, and you check for, and now you found out that she has a pulse. How will you open her airway? How will you open her mouth? Will you put fingers in the mouth and pull the jaw downwards? Will you do a head tilt and chin lift? Will you pull the tongue forwards or wait for help to arrive? Now, if you go through all of this, you can't do the first option. You can't put the finger in the mouth, pull downwards. You can't stick your hand inside and pull a tongue. That's dangerous. And waiting for help is too late. So the correct answer will be do head tilt and chin lift method. This is answered by 90% of the people. You can see the image here. The other options, you like putting the hand inside and taking tongue, all that is dangerous. You just do simple technique like this. This opens up the airway, air can go in easily. The tongue comes up forward and hopefully they can breathe well. Fourth question is straightforward. How much will be the chest compression and how many breaths will you give? Very easy. Give 30 compressions, count from 1 to 30 and give 2 breaths. So again, this was answered by 91% of the people. Remember this image. It should go on 30 compression, it's to 2 continuously. At least 2 inches, nice and hard. Push hard, push fast. Remember that motto in your head. Fifth question. You see a child, a 4-year-old choking and falls to the ground and becomes unresponsive. What will you do next? Give 5 back slaps and 5 abdominal thrusts. Put the finger in the mouth. Give rescue breaths. Remember, the child has been choking. So just giving back slap, putting your finger in the mouth, and just doing chest compression will not help. You have to do this thing first. 5 back slaps first, then 5 abdominal thrusts. This was answered by 65% of the people. I think there might have been some confusion because of child being unresponsive. What do we do? The first thing is make your attempt to take out the foreign body. Remember that. Once the foreign body is out, then you can proceed to the next thing. If the foreign body doesn't come out, the child is still unresponsive, then you can go on to rescue breaths and chest compression. But again, you should have checked for the pulse of the child. Remember, the main problem here is not being able to breathe because due to choking. So if the choking comes out, child will be fine. Yeah. So if you're in a cafeteria, you see a woman grasping her throat and appears to be in distress. Maybe she's not breathing properly. Now, you might think, is she okay? Give her some water. Giving water is dangerous. Putting comfortable position will not help because she's not able to breathe. So what you will do, you suspect she's choking, go ahead and perform Heimlich's maneuver, abdominal thrust. This was answered by 81% of the people. Some people might think, shall I go and ask her if she's okay? But remember, the universal sign that somebody is choking, you can make sure that you know that they're choking. Just go ahead and start the abdominal thrust. Remember, make a fist from your hand, compression in the chest. Yeah. Again, you're eating in the cafeteria, you see a woman developing swollen lips, rashes, and not being able to breathe. Now you understand, okay, she has anaphylaxis. Where will you give the injection? So simple, outer aspect of the thigh. It's actually any thigh, left thigh or right thigh. There's no particular side. This is answered by 50% of the people. I don't know what the confusion was. Remember, the buttocks and arm and all not necessary. It has to be the outer part of the thigh. Inner, okay, but the answer is always outer part of the thigh. And the adrenal injection should be given 0.5 for adults, 0.5 for 6. The injection is just like a diabetes injection. Chest compression for a child, if there are two people, remember, it's 15:2. This is answered correctly by 79% of the people. For a child, it's different. It's 15 compressions, 2 breaths. Okay. For adult, it's 30 compressions, 2 breaths. Yeah. Yeah, we move on with this. Okay. We've shown this as well. So the last bonus question. Which of these is an ideal recovery position? Simple. You can't put a person like this. He can still choke in. This is not very helpful. He can't breathe properly. Sideways, the way you sleep at night, that's the best recovery position. We spoke about this last time. Yeah. Put the head supported like this, put the knee, and everything comes out of here. Okay. Now I'll give over back to Nabil and he'll continue with the trauma life support. Yeah. Back to you, Nabil.
Hello, can you hear me?
Yeah, continue.
Okay, fine. Were you able to hear me? Did I lose my voice in between?
We didn't hear you in the beginning.
Okay, sorry. Fine. Jazakallah khair for the question answer, Dr. Zishan. We will catch up again during the Q&A session, inshallah. So today's class is on basic trauma life support. And from now on, we're going to be talking on various different sorts of trauma. So when I say trauma, if for those of you who don't understand trauma, we're not talking about the mental trauma, we're talking about the physical trauma. So all sorts of injuries that can happen and cause severe disability or even death. So there is a definition that it's an injury that can cause potential harm to you, where you either some part of your body doesn't work after that, or you can even die. We see that as a car crash, okay, and that can happen during a bike accident, that can happen during a building collapse, or someone's been shot, someone's been stabbed, or anything, even right from the kitchen you're working at. Okay, it could be a cut injury all the way to something really large scale outside in the road. And the prevalence of trauma is varied across the world, but if you see the map, the Southeast Asia, okay, the injury that you get from a trauma and the effects of that on your brain, okay, it's called traumatic brain injury, is very severe, okay, in the Southeast Asian region. You can see in the map. This is from 2018. That's the highest, where the reason for that is so much. Okay, for those of us who are from Southeast Asia, we know that our healthcare system, or the time to which a person who can be taken to the hospital, all of that is still a long way to be improved, actually. So we're not exactly in a situation where we can expect that a paramedic or an ambulance arrives right on scene immediately, okay, or at least in the next 10 to 15 minutes, and then they take the injured patient to the hospital. we may not be able to see that happening. So the reason that we are stressing this on you is because maybe you're the first aid person at that point, first aid giver at that point, and you could be the only lifesaver at that point to help that patient. There are, when I talk about trauma, there are a few injuries which are irreversible, where the injury is so bad that the person just dies, and it's immediate. You cannot do anything about that. And there are a few situations where you can do a lot, till the patient reaches hospital. And various studies have been done on it. The main focus is that the injury, this map is to show that there's so much of trauma happening, and there is so little being done in the community. This is just an example of, there are various videos like this. This is an example to show what can happen during a car crash, for example. You see 3 people who are wearing the seatbelt, and there's one person who's not wearing the seatbelt, and how much damage can happen to him or her, being thrown off. And these tests are done by all these, car companies and motor vehicle companies for the reason to find out, where is exactly the impact of this injury? How does this happen? And so they study a lot using these videos. This is again an old video to show, what happens when you wear a CC. This person is not wearing a seatbelt. The amount of impact the chest had on the steering wheel, is enormous. And compared to a person, who was wearing a seatbelt and has this, airbag. So these things, the learning of the things you learn from these things are the mechanism of injury. So the thing called mechanism of injury is a complete separate topic. Inshallah, in the next class, maybe you can touch on it a little bit. But each different type of injury has a different mechanism. And that mechanism will tell how severe the injury can be. This is another example where very commonly we take our children in the car, but we don't give heed to the fact that they're not restrained, either in the front or the back. And this is just a glimpse to show how much the impact can be. During an accident. So all of this, for those of you who know a little bit of physics, know that this is all because of inertia. When the car comes to a stop suddenly, the person who's not restrained, the child who is not restrained, is thrown forwards. And these are mistakes we all make in terms of taking it too lightly, that fine, nothing's going to happen. But it's all fine until the time that you have to stop suddenly. Either you're stopped by a car crash, or you try to apply brake when there's someone in the front, and you'll see all sorts of injuries taking place at that moment. So these videos are just to show that trauma happens really, really very quick. And there is no time to actually even take to give a second thought. It happens really quick. And that's why all these regulations on seatbelt, restraint, following the signboards, controlling a speed, all that comes into play because of these reasons. They didn't just come out of random numbers. It all came after studying all these factors. Number of injuries they've seen over the years, and also ourselves as doctors, myself, Dr. Zishan, and Dr. Nuruddin, Dr. Vikas, all of us have seen plenty of cases. In the last few years, where people have come in various different ways of sort of injury, some with head injury, chest injury, abdominal injury, various different injuries. And many times we find that people are not restrained. Many times we find that people are not wearing helmet, things like that. And that, for example, take a picture like this. There is a helmet. Yes, but it's not in the right place. He's wearing the helmet in his hand. And he's speaking on the phone. Now imagine this person, if he had to suddenly stop. And or a car comes suddenly. The amount of injury he will incur is much more. Than if he wore the helmet. It's obvious. And so helmets are proven to be really useful. It's one thing that has been established perfectly. 60% of your head injuries can be reduced because of a helmet. So for those of you who travel in a two-wheeler, don't take this very lightly. Helmets are really important. Those who travel in the car, don't take it lightly. Put your seatbelts on, even if you're sitting in the back. Especially if you're going on a fast and a long journey. So coming to our assessment, okay. So when you see a trauma patient, when a person is injured in an accident, okay, you approach the patient in the same manner as we discussed before. Okay, DRS ABCD, look for danger, look for response, okay, and then you shout for help, ask for more help if you're the only person. Then we talk about airway with C-spine. We'll explain what that is. Then we go to breathing, circulation with hemorrhage control. We'll talk about that, and then disability, and there is E as exposed. So there is a way to approach an injured patient, okay, injured person in the road or anywhere else. The first thing you have to go is go near the person, okay, and hold both sides of the head. Okay, I'll explain to you why this is important, but this is how you approach. Just hold them from both sides of the head, okay, and then look for the airway. Okay, see if they're responding to you, talking to you. Hello, sir. Can you listen to me? Can you speak? Or can you open your eyes? Ask them to talk. If they're not able to talk, if they're not breathing properly, or if you're hearing any gurgling noises from their throat, their airway is not intact. They're not taking in proper air in and out. So what did we learn in the previous classes? We would do a head tilt chin lift, isn't it? So we should not do that. Okay, no head tilt chin lift in a trauma patient. Okay, the reason being that they could have broken their spine, that is their, the bone in your neck. And if you do head tilt chin lift, it makes things worse for them. So instead of that, what we do is jaw thrust. So your lower jaw is the jaw that the two bones of the face, and the upper, you have the upper part and the lower part of the face that is mobile, that is moving. Okay, the lower jaw. So if you lift the lower jaw up, your airway will be open. And that's how we do it. So for lifting a jaw up, you don't need to head tilt or chin lift. We will demonstrate this. Inshallah, Dr. Vikas will be demonstrating how to do that. And there is a video here as well, short video. You can see how a jaw thrust is done. I hope that's clear. So playing again, you see he's keeping both the thumbs and using the fingers below, he is lifting the jaw up, lifting the jaw, just bringing it straight up. That opens the airway for air to freely move in and out. And there's another way of doing it in terms of approaching from the back. So the first step is to make sure that they have severe neck pain, or they probably, because of the mechanism, they have sustained a neck injury. Go behind them, sit, keeping your elbows resting on the ground. Okay. As I mentioned, this is how you approach a person who's injured. Always go from the back, hold their neck, make sure they don't move their head. Okay. And then you see that he's done a very simple procedure. He's just using his two fingers and just lifting the jaw from that angle. Okay, you can feel your bone on that angle, just below your earlobes. You can feel the angle of your bone. All you need to do is just lift it up. And do not tilt or rotate the head, and that will make things worse. So the bones in your neck are called cervical bones. Okay, the bones below that have different names. The 7 bones in your neck are called cervical bones. And from them, in between those bones, there are nerves coming out. Those nerves supply your arms, legs, and they're very important nerves coming between those bones. Okay, and even some part of your breathing, some part of your heart rate, and all of that is controlled by some of those bones, some of those nerves coming out. Now, when those bones are fractured, they can compress. Okay, they can compress the nerves and even the spinal cord in itself, and completely make the person paralyzed. Things like this should not be dealt, in a light manner. Where, I know people want to help. People suddenly carry the patient, the person who is lying on the floor with the trauma. Okay, you can see in the first picture, this person's head is hanging down. If you sustain the neck injury, okay, what will happen is this way of carrying is making it worse. If that spinal cord is compressed, he could be paralyzed for life. Okay, and this is an image, okay, an X-ray image or a CT image I would say more than a CT, it's an MRI actually, the right one. You can see the cord getting compressed because of the bones being fractured. When the bone fracture, they will go and press on the cord and make the person completely go paralyzed. Okay. So this is the reason we don't want you to move or to rotate the head as we like. Okay, you have to keep the head still. One wrong move, okay, that can make the person disabled for life, and we have seen that. Okay, when I was working in Kerala, I saw a lady who had a fall from a two-wheeler, not much of a height, okay, but her spine was completely crushed from one angle, one side. One of the top part of the spine was, the bone was crushed, okay, and that pressed on the cord. She couldn't move her hands, she couldn't move her legs, and she won't be able to use her hands and legs for the rest of her life after that. And such injuries can be prevented. Okay, if it happens naturally, Qaddar Allah ma sha fa'al, that has happened. Okay, the Qadr of Allah. But at least if it has not happened, we shouldn't be the one causing it. Okay, and that's the reason we can't just pick any person from the road just like that and throw them into the auto or taxi just like that without any measures. Okay, we have to hold their neck, keep their neck still, and then move them. Okay, it's very important. For that reason, we have to stabilize the head. Ideally, if there is a board beneath the person, that's really helpful. You can keep two blocks on both sides so that they don't move their head. And we will demonstrate this, inshallah. Dr. Vikas will show how to do that. And then we do something called triple immobilization. If there's a board below the person, you just keep two blocks, then you put a strap on the forehead, you put a strap on the neck, on the chin. So one on the forehead, one on the chin. In that way, the head is stabilized. Okay, you won't be able to move the neck, okay, much. Then that was A, airway with C spine. Okay, coming to B, this is breathing. Okay, so there are a lot of breathing issues that can happen in a trauma, like how we saw in the first video of a person crashing onto the steering wheel, okay, without the seat belt. His chest can be bruised. And sometimes this is the only thing you will see when you see a person's chest in a trauma. You won't be able to see anything else happening inside, because inside there's a lot happening. He could be bleeding in the chest. He could have an air that's getting built up in the chest. And all of that can make his breathing worse. And some of these are so severe, they can even rupture one of the major arteries. They can have injuries to the heart. But unfortunately, as a layperson, we cannot do much. Okay, like for example, you can see this lung is fully inflated. There's a normal lung. The right side lung you see is small. The reason it is small is because there's air around it. Where did this air come from? From the outside, because of a fracture, rib, or something that has caused the air to just accumulate around the lung. And and sometimes can be blood as well. That can reduce the breathing. And these are the reasons where people are gasping for breath. People are suffering to take, they're struggling to take a breath. We can't really do much, unfortunately. However, there is a technique. Okay, some people who are trained in first aids. Okay, if you're particularly trained in trauma first aid, you can use a needle, okay, a small needle, okay, to make a hole on the top of the chest, on the side of the chest, to release the air. That could save a person's life. There are plenty of people who have done that in airports, in buses, in trains, in streets. Okay, so it's possible to do, but you need to be trained in that. So B, there is nothing much to do. Okay, A and C we can do. B, not much to do on scene for a normal person. So I'll stop at that, and we will go into quick demonstration at the moment. Okay, and then we will continue with C. So it's Dr. Vikas here. I would like you to give us a quick demonstration on this. You can switch on your video. I'll stop sharing. Yeah. I'll ask all our participants to please mute their microphones. Yeah. Walaikum assalam. So we have Dr. Vikas and Dr. Nabil. Dr. Nabil is the one who's recording the video, and they've been, they're actually currently working in the emergency department, but they have taken time out for us and they've given their valuable time for us at the moment to give us a demonstration. So Jazakallah khair, Dr. Nabil and Dr. Vikas for giving us the time. And yeah, so Dr. Vikas, let's start. So here it is, you're in Kerala. Let's start with there itself, okay? And on the road, you see that there is a bike accident, okay? All of a sudden, a man has hit one of the buses. He's flown off the bike, fallen on the road, okay? You're the next immediate person to him who is the first aider. You're approaching the person. We'll do from DRS, okay? Checking for danger, like making sure there isn't anything obvious, like a petrol is leaking around the bike and then there is fire or something. There's no obvious risk to yourself first. Okay, so that's D. Then checking for response. So when you approach the person, you watch how Dr. Vikas approaches the trauma patient. Hello. So he goes and stabilizes his head, sorry, by using his hand from both sides. And he actually holds his shoulders, okay, and then you see that he's resting his palm and the forearm around the head. Yeah, beautiful. So this is how you go and approach the person. The reason why he's doing this is so that he doesn't move his neck much. And then you ask for a check for response. Ask, hello, sir.
Hi, sir. Are you okay? Hi, sir. Are you okay?
Right. So in this, yeah, great. So in this, most of them, let's say we are talking about people who have pulse. We're not talking about the people who don't have pulse. It's very unlikely that a person loses pulse immediately, okay, in a trauma person. Usually they have a pulse, okay. So he might be gurgling or might be, just moaning some sounds. He's like, he's making some noises. There's some injury to the head. The next step would be that Dr. Vikas sees that he's not talking, okay. He's noticing that his breathing is not great and he's making some gurgling noises, okay. The first thing would be to give a jaw thrust, okay. So you can see that he lifted his jaw from the bottom. Okay, he's kept his thumb on the cheek and he's used his finger from below to just lift the jaw. But he's not doing a head tilt chin lift. Okay, he's not tilting his head, only lifting the jaw. Like that's it. A simple procedure. Just lift a little bit, few centimeters above, and that should be sufficient for the air to move in freely. That's all. Okay. Use your fingers, go to the angle of your mandible, that's your bone, jawbone, okay, and lift it up. Okay, because usually if they don't have response, they don't have much of control, the jawbone will be loose, you can easily lift it up. Okay, and that should reduce the sound, whatever noise you're hearing, like a gurgling noise or a noise that is happening because of obstruction, should be cleared because of that. So he has done initial assessment, okay, airway, he's making it patent, holding C-spine. Ideally, if there is another person, they can hold the C-spine and then Vikas can do the jaw thrust. Okay, the more the people, better. So, but if you're the only person, there's no other option. Okay, you have to stabilize the head and do a jaw thrust to keep the airway open. But if the person is talking, let's say the person is talking, okay, and he's saying that my neck is hurting, okay, and he's saying that it's really painful, okay, all you need to do is just make his neck stable. And Dr. Vikas will show, if let's say there is a board below, like that, the head, you can keep 2 blocks on both sides. So these are blocks which are obviously medical, for medical equipment and stuff, but you can use anything. You can use a sandbag. You can use 2 small bags on both sides of the head, okay? And then use a strap, okay, one on the chin and one on the forehead. Okay, you can use a cloth, you can use anything. That is if you want to leave the person alone, okay. But in the sense, if you're going to be checking other things and you don't want him to move the head, you can do this. But if there are 2 people, you can always hold the neck and keep it steady. You don't have to use this, and then the other person can check the rest of the body. But if you're the only person there, you can just use 2 things, 2 objects on both sides of the head, and then put straps on both sides. Okay, this will keep their head still. Okay, that's right, isn't it? So, Dr. Vikas, you agree, right? This is the right way to go about it?
Yeah. We can keep 2 blocks, any blocks. so that
Yeah.
you don't move the head from left or right. Okay.
Yeah.
You're immobilizing the neck part. So ideally, you can reach through the shoulders and up to the
Yeah.
head. Any block can work.
Perfect. Okay. So quickly, can we just run over it again one more time? Okay. Because today is the first day we're talking about it. There will be doubts about it. So let's quickly run over it. So DR is ABCD. We're checking for danger. We're going to attend to this person who's fallen off the bike, checking for danger, no danger. Then you approach the patient.
So,
You check the
are you
response
okay?
for that. Yes.
So, are you
So you can
there?
give a quick squeeze in your neck, and where he's holding to check for pain response. It's nothing. Okay. And so this is how you hold the neck, keep the neck in position, in center, not letting it move left or right. Okay. And we already explained why we are doing this, so that we can avoid any neck injury that can paralyze him or even make him stop breathing. Great. So thank you, Dr. Vikas. We will continue our demonstration after the next slide. Great. So after that, so we finished A, B, airway breathing. Okay, we're going to circulation now. It might look a little brutal to many of you, in the sense there are many of you who wouldn't even like to see blood, okay, and who might get really faint when you see blood, okay. But it's just like how we explained last time, this is a life-saving procedure, and sometimes we have to step forward, okay, get rid of our fears and go and act at that moment to save someone's life. So bleeding is one of the major causes, okay, of someone actually losing their life even before they reach hospital, okay, because they've lost enough of blood. And the blood in the body is only limited. We have 4.9 liters to 5 liters. It's plus or minus, okay, around about 5 liters of blood, okay. Sometimes you could lose liters of blood, 1, 2, 3 liters of blood with one single injury, okay, in your abdomen, in your pelvis, it's your hips, okay, your chest. You can bleed a lot. Sometimes from the wound in your legs or hands can bleed so much. So what do you need to do to stop bleeding? The obvious response to any person who starts bleeding is to actually, go and compress it. Yes, most of them do that. But the problem is how much to do it and what else you can do after that, right? So it's a simple 3-step process. First thing is applying direct pressure with your hands on the bleeding spot. So when you see bleeding from your limbs or arms anywhere, go compress it with your hand immediately, even before you get a cloth or a gauze. Okay. So next step is, when you get the gauze, quickly switch it to the cloth. Keep a cloth inside on the top of the bleeding and press it really hard. Okay, make a roll of it and just press it really hard on the bleeding point. And compress it for 10 minutes. Okay, do not take off your compression and have a look. Don't do anything, just keep compressing it. Okay. And if the bleeding continues despite you compressing, then the third step is something called tourniquet. So you apply a tourniquet, you apply a bandage above the bleeding spot. You're basically making a knot and a tie around above the bleeding spot, so that you can stop the blood flow, to that wound. And a person who's bleeding a lot, okay, eventually, obviously, he needs to go to hospital. If they lost a lot of blood, they need blood, okay. But this is an interim process, okay. This is before you take the person to hospital, you make sure that they stop bleeding. That makes a big difference. Someone who's bleeding, in the photo you can see who's bleeding from a leg here, looks like it's partially amputated, okay. I didn't want to put a lot of pictures, okay. There are a lot of bleeding pictures. I didn't want to put, I don't know how it will be for most of you who might be seeing for the first time. So it might be really distressing. So that's why I didn't put a lot of partial amputation pictures and other things, which is seen after accidents, where someone's leg might be broken completely. One side, some part of the leg is hanging out. A lot of things can be there. Okay, there are a lot of pictures. I didn't want to put most of them, but assume that this person's leg below is not there. It's amputated. Okay, it's completely torn off from the below. if this person, like you see here, is applying a tourniquet, if he doesn't do this now, he'll be losing so much blood, okay, by the time he reaches hospital, that he might even have a cardiac arrest. By the time he reaches, he might die after that, okay. And it does happen. It has happened, okay. It does happen very frequently. So it is very important that you apply the tourniquet immediately to stop the blood flow. Okay, the blood is flowing out from this part, which is broken and it's torn off. So the first thing for you would be to give a compression. Okay, that is the last step. Well, the tonic is the last step. The first step is compression, and you compress it hard for 10 minutes. And there is this urge for you to see, is the bleeding stopped? So many of them, after pressing it for some time, they just lift it very slowly and have a look, see, is the bleeding stopped? No, don't do that. That is a mistake. Okay, the reason I'm saying that is because it takes time for the clotting factors which are in your blood. There are small chemicals in your blood which actually come together and form a mesh. They stop the bleeding. In order for that to take place, the bleeding rate, the flow of the blood should be stopped, okay, out. So for that, you need to compress it and keep it really hard. Do not let the bleeding point go at least for 10 minutes, minimum 10 minutes, okay. And if the bleeding doesn't stop, like I said, the last resort is to use any material possible, okay, to create a tourniquet. Okay, just put a strap around the leg. Let's say you're bleeding below the knee here, your strap should be here. Okay, it's logical, isn't it? If you're bleeding here, you should put the strap here. And so if you're bleeding here on the top part I'm showing, okay, there's no point of putting a strap here, right? The bleeding should be below the strap. So Dr. Vikas will demonstrate again how we can do this. Okay, it's a very simple technique just to create a tourniquet. Okay, and there is a diagrammatic representation here of how to create a tourniquet. See, someone is bleeding in the forearm right now, and you apply a cloth like that on the top. You can keep a stick, okay, anything hard, and then tie the stick with the same cloth, one end, and then just rotate the stick. Okay, it's simple physics where it will create a pressure there'll be a force created, okay, on that knot when you rotate it, and that will reduce the blood flow below. Obviously, if you keep it for a very long time, that means you're reducing the blood flow to the rest of the hand, which is not good. Okay, your hand is not getting any blood supply. But what is more important is that this bleeding has to be stopped, and this is a very temporary measure. So you can do this, okay, and then take the person immediately to hospital. Okay. And what happens after that is again a great a creation of Allah. Okay, I don't want to. This is just to show you that there is a lot that happens. Okay, before the blood gets clotted. Okay, and how the bleeding stops. Okay, again reminds me of the ayah لَقَدْ خَلَقْنَا الْإِنسَانَ فِي أَحْسَنِ تَقْوِيمٍ, that we created man in the best of the forms. There is so much that happens inside. Okay, which we don't know. It just makes us say subhanallah, that the amount of, and we're still trying to learn a lot on these things, how the blood works. Okay, there's a lot of things inside the blood that makes this clot being formed, and it stops the bleeding eventually. Okay, so, and then the mesh is created. You can see this is the red blood cells, and then the clot is formed eventually. Okay, so let's go to a demonstration, and let's see how Dr. Vikas can show us how to stop a bleeding. Dr. Vikas, I would like you to come on video now. I'll stop sharing. Great. So
Hello,
let's say, hello, hi. Yes, Vikas, you can hear me?
Yeah. Can you hear me?
Yeah.
I can take up, I'm showing Dr. Nabil's
Okay, fine.
demonstration. Right?
Great, okay. So let's assume this is the same person who has fallen off the bike as we discussed first time. Okay. You see that he's having a big bleed in his leg. Okay. He's fallen off the bike. His leg is caught up in the wheel. He's bleeding massively from his leg. And so what are you going to do? Let's say, assuming that there is blood, we can't show blood at the moment, but assuming that he's bleeding from there. Okay. First thing is to compress it. Okay. Use your hands if you don't have anything, and just compress it really hard. Press it really hard, make sure the blood doesn't come out. That's how much you can do at the moment. Then if you get a cloth, switch it to a cloth, okay, and press it hard. Okay, ideally if you have a piece of cloth, just rotate it, okay, make it small and then try to compress it, okay. And you can do this for 10 minutes, okay, making sure the bleeding, if let's see if the bleeding stops or not. If the bleeding has not stopped, okay, and you see that the whole cloth is soaked in blood and is still dripping off blood, and what will happen is eventually, the blood flow will be so much that you will have to apply a tourniquet. Dr. Zishan, can I ask if is the video clear for everyone? Is everybody able to see the video?
Yeah, it's clear, Nabil.
Okay, fine. Because I saw in the chat few people was mentioning they were not able to see the video. Okay, fine. Okay. So the first thing would be, you can see that the bleeding has not stopped. So now Dr. Vikas has put a tourniquet above the wound, let's say on the thigh. He has put a knot. Okay, first put a strong knot. Okay. And then you use a hard stick, let's say a stick nearby, or let's say if a pen or something is there. Okay, pen is also good enough. Just put a knot on the pen on top of the knot which is already there. Okay, tighten it. Great. Now all you need to do is just rotate. You can put few knots, make sure it is strong. Okay. Yeah. And then you can just rotate. Yeah, you can rotate the pen as well.
You can rotate pen.
Yeah. Perfect. So he doesn't want to do it really hard because it's going to hurt Nabil, who's lying down there and he's giving his leg for demonstration. So we're not going to rotate it fully, but you can keep rotating it tight so that you can see that the bleeding will eventually stop from this point.
We can stabilize
point below.
the other end of the pen.
Yeah, and then just to keep it in position, you can rotate it and then fix the pen in one position and then make a tie on the other end of the pen. So this is a simple tourniquet, and we hope this should work to stop the bleeding. This is again a temporary measure to reduce the bleeding below. Okay, and they should be rushed to the hospital immediately as possible so that they can apply a proper tourniquet or do other things. Fine. Jazakallah khair, Dr. Kasan, Dr. Nabil. So this can be done on the leg and on the arms. Okay. Great. So I think we're done with this. We started off with airway, breathing, circulation. I think today we did 3 different things. Okay, and we've covered those initial aspects of trauma. We'll open the floor for question answers now, and we'll see what we can answer, inshallah. And the remaining bits will continue in the next class, inshallah. So Dr. Zishan, and I will ask all of you to ask questions now. Put your questions in the chat box. And is there anything you would want us to demonstrate or want us to show again? We're happy to do that. Our slides are here. We can scroll back on the slides and we can show you anything that you've not understood as well. So please put in your questions. We will try to answer, inshallah.
So the first question is, Nabil, how long can we put a tourniquet on a person? And will you put it only if there is too much of bleeding, or will you do it for minor bleeding as well?
So the tourniquet, like I said, if it is a catastrophic hemorrhage, okay, let's say when I say catastrophic hemorrhage, I mean the bleeding is so much that, like I mentioned previously on one of the slides here, this is a catastrophic hemorrhage, okay. This person has probably lost a limb, okay, on the below. He's completely torn off and he's bleeding severely. In this point, there is no point of going and putting a gauze or a cloth there because the leg is broken, okay, and he's bleeding. In this, you have to directly go put the tourniquet. There's no room for applying a gauze below, okay, or applying pressure below. This you have to put a tourniquet, and this is life-saving for the limb, or the limb saving actually for this person. And the tourniquet can be applied. So it's an interesting question. This is something which is very debatable even among us. You know, in places like, a lot of these studies have been done in Afghanistan and in Iraq and other places where, you know, a lot of people have done studies on bleeding patients, bleeding limbs and other things. And in those places, people have applied tourniquet even for 6 hours, okay, or 7 hours, 12 hours and stuff like that, okay, until they have transported other places. But that is a war zone, and those studies were done there. In civilian population, we hope that it shouldn't take more than an hour or two for you to actually reach the hospital. Okay, and it is fine if you apply a tourniquet, and in between an hour, every 1 hour, okay, you can release the tourniquet pressure a little bit and then tighten it again. Okay, so that a little bit of blood goes to the rest of the limb. I think that should be fine, but don't worry about it. Like I mentioned, when you apply the tourniquet, take the person immediately to the hospital. Great.
Yeah.
So doctor, yeah, go on. Let's see if there's anything else. Yeah, so someone asked if the tourniquets are only for arms and legs. Yes, we can apply tourniquet only to arms and legs. We cannot apply tourniquet to any other part of the body. Obvious that you can't apply to the chest, abdomen, can't apply to the hips. If you're bleeding from those places, all you need to do is just apply pressure. You cannot apply, a tourniquet anywhere of those places. That's not possible. So, Dr. Zishan, can you explain a little bit about, if a person is bleeding from elsewhere, and your experience, you can share what you've seen of a person bleeding from elsewhere, from the chest, abdomen, or pelvis.
Head to toe. See, if a person is bleeding from somewhere else, the best treatment is applying pressure on it. You know, so your hands and legs you can apply tourniquet, but other parts of your body you can't. Someone is bleeding in their tummy, or in their chest, or even bleeding in their head, you can't apply tourniquet there. But if you see something coming outside on the skin, the best thing is apply physical pressure on it. Get a cloth and apply as much pressure with your hands as possible. Okay. If someone is bleeding from their head after injury to their face or wherever, put pressure on it. Same thing on the chest or tummy as well. If you can see blood coming out, just put pressure on it. If it's anywhere on your legs, below your thighs, ankle, knee, whatever, foot, same thing, hand, elbow, hand, wherever you can apply tourniquet. Other places, just continue applying pressure until you stop the bleeding. That's it. It's as simple as that.
Yeah, thanks for that. And like I said, there are few injuries where you cannot do much in terms of your fractures and major bleedings. You won't be able to do much. So in those scenarios, don't worry. It's not your fault. You won't be able to do. You can't save every bleeding. Okay, whatever bleeding you can see outside, you can stop. Whatever is happening inside, you won't be able to. Fine. And
I think someone wants to see how jaw thrust can be done.
Yeah, I'll stop the screen sharing. Can Vikas show again how the jaw thrust is done? Dr. Vikas, you can come on the screen and show us how jaw thrust is done. Yes, Dr. Zishan, if you can coordinate with Dr. Vikas. I'll be just muting myself now. Yeah.
So you can see you come from behind the person, and where the jaw, the bone is, where if you can just show the bony part of the jaw. Yeah. So you just put your fingers there and you start pressing upwards. Okay. So from your thumb, you put pressure, and then with your 4 fingers, the index finger, you start pushing it upwards. When you do that, the jaw comes out. The whole point of the jaw to come out is the tongue under the chin, like under the mouth. The tongue also comes up when you do a jaw thrust. So this opens up the airway to breathe. Jaw thrust. We do not move the head completely, like head till chin lift. No, because they might have spinal injuries. Remember, with spinal injury, someone might get permanently paralyzed. So we just put the pressure on the cheek, and then from below, we just lift up the jaw only. That's it we do. Yeah, thank you, Vikas. And people are asking how long can you apply pressure? How long can you put a tourniquet? See, pressure apply until the bleeding stops or you reach the hospital. Same thing with the tourniquet. Tourniquet, people say, I've read, we had a discussion with a US doctor, army doctor who was in Iraq and Afghanistan. He had come to India to teach us. So he was talking about how long tourniquet can be applied. So tourniquet can be applied, according to him, 30 minutes, 1 hour. So people have gone even longer than that. There are some people who will say that don't apply for more than half an hour, more than 1 hour. But the point is, it should be applied until you reach help. Okay. Don't think that I'll just leave it for 1 day, 2 days. No, obviously you should have gone for help by then. If somebody bleeding continuously from their hands or legs, put a tourniquet, put a tight one until the bleeding slows down, then take him to the hospital. Don't think that just by leaving it like that, everything will stop and heal by itself. No. If there's so much blood coming out, it has to be stitched and closed. So half an hour to 1 hour is fine until you reach the hospital. Now for you, Nabil, there's a question. Hello, Nabil. So people have asked, in case the vicinity of the accident isn't safe, where there's fuel leakage, how can a first aider be of help to the casualties? So look, if there's a fuel leakage, remember, you have to be safe first before you reach the safe area. Okay. You cannot go in if there is fire or petrol or whatever, some strong chemicals. No, you shouldn't risk yourself. Make sure you're fine. If there is safety enough to pull out the person, go pull out the person and then help them. But don't go and risk yourself. That's what first aiders do. The moment they reach the spot, they will look around everything and see if there's any wire, oil, or petrol or something burning. If there is something, they'll let the fire engine team come and help, or whoever can help. If not, they will be safe. Only when it is safe, they'll quickly go and take the person and come out. Now, there's another question, Nabil. You can answer. What will you do if there is a broken bone?
Yeah, so regarding fractures, okay, and head injury, I think there are questions on both. So inshallah, about head injury and fractures, we will talk about it next class, inshallah. I thought it'll be a lot to talk on one class itself. So how to immobilize a limb that is broken, we'll have to show you separately how to do that. So I thought the bleeding is the more important bit to explain first. Inshallah, the next class we'll show how to immobilize it. Like you have to pretty much straighten the leg or the arm with two supporting hard structures. And inshallah, we'll demonstrate in next class. Yeah.
Another question is, what will you do if there is some sharp object piercing inside site of injury? And some interesting question is, what if there's a knife in the body? Someone has stabbed someone, or some sharp object is there.
Okay. So it depends on which part of the body. So if you say that it's a sharp object in the chest, that is stabbed, someone is stabbed to the chest, we see that as well. But most of those cases come to the hospital, and there we have a completely different procedure. Depends on which side of the chest it is. We do a lot of things. But on scene, please do not take the knife out of the chest. Okay. The first important thing is to just leave. If you see a person being stabbed to the chest, just let the person be with the knife just on that. Okay. Do not go and take the knife out of him. What will happen is that if that knife could be just piercing through an artery, okay, and probably would have just created a clot there. If you take the knife out, you're disrupting that clot and he'll bleed more. Okay, just call for an ambulance and they will come and take him to the hospital. In the hospital, you can remove the knife because there, if the bleeding happens, they can control it. I hope that is clear. And yeah. I'm not able to see all the questions because in between I think I lost line a bit. So Dr. Jishan, you'll have to read out the questions to me.
Okay, so yes, so people asking about knife again. Okay, so when transferring a trauma patient to a car, is a board necessary for the head, or should you stabilize the entire body of the patient under the board, or wait for ambulance to come, even if they're taking a long time to come? So you want to answer that, Nabil? Okay, so we can't hear Nabil. Okay, so it depends. See, when transferring a trauma patient to a car, is a board necessary? So first thing is, what kind of board do you have? Does everyone have a board all the time available when they're traveling? No. Even if you see an accident, will people have a board ready over there? No. If technically you have a board, will your vehicle be big enough to transfer the patient in that board? Probably not. So that time what you will do is, let's say if you are in a vehicle, I would suggest put them in the vehicle and don't move them as much as possible. Keep them steady, as much immobile as possible. Bigger vehicle, it's easier to do. If by some chance you have a board near your house or someone's car or whatever, put them in the board and don't move them at all if they come. If you have space to do it. Okay. If you think the ambulance will reach in a few minutes, then that's good. Let the ambulance come and take care. But if you're in a faraway place, half an hour, 1 hour, it's better that you put the person in the car and don't move them, disturb the body as much as possible, and take them to the accident place. The problem is autos. People will take one person and 2, 3 people get into the auto and squeeze that person and take him to the auto. No, that's dangerous. I think as much less mobility as possible should be done.
One other thing I wanted to mention was, once I was coming back from work in Chennai, when I was working in Chennai, I saw a man was, fallen off the bike. He's bleeding severely from mouth and other places. There was a crowd, as always, around the person. There were police. I stopped the car in a nearby distance and I came. Then I wanted to help this person. I didn't have, anything at that point with me immediately to help. But he was bleeding. But a lot of people were standing and watching. There was a delay in the ambulance reaching to him, at least for about 40 minutes. It's a big time. There was a big delay in the ambulance coming to him. People are watching. Okay, a lot of people are watching. Surrounded, they were taking photos and things like that. But nobody actually stepped forward to do anything to him. Okay, I don't know at what point he has bled so much. I couldn't do much. He was bleeding from his mouth and nose and other places. We had to mobilize his C-spine. I was holding the head. The ambulance came eventually, okay, and they moved, like you asked, we did put him under the board and we moved him to the ambulance, okay, and we gave oxygen and other things. But the point was that, even when I was trying to help him out, a person came next to me. I thought he was coming to help me, okay, but he comes nearby, okay, and all I see is just a flash of light and he takes a photograph. That's it, okay, and he goes. I'm saying that the people's responsibility on these situations are not great. Okay, and I'm not saying everybody needs to know this, but those of you who know should immediately do something about it. Those who don't know should at least help in some manner, get their car, get their something, okay, to help them out, something like that. But nobody came and did anything. Okay, at that point, it is very sad actually. That person died eventually without any help. Yep. So someone is asking about, sorry. Someone is asking about the crime scene situation.
I mean, it's legal aspect, different countries, different rules.
Exactly.
If you can remember, if you can save a person, you should be saving a person.
Yeah.
That's
so I was reading
important.
about this. Okay. I mean, I'm not aware about every single country, obviously, but from India, I did read a paper from the Gazette. Okay. That it's legally allowed under the Good Samaritan law. Okay. under the Good Samaritan law, you're allowed to help a person, okay, to save a person's life, no matter who he is. No matter who he is, you're allowed by legally, and there is a court paper on it. Okay, nobody will say anything. That is if the person is dying. Okay, obviously we're not telling you to destroy the forensic evidence and other things. It's not about that. There will be marks of that, but this is our responsibility to save a person's life, and even by law we are covered when we do that. Yes, Dr. Zishan, I don't have much of the chat questions. You will have to tell me because I lost this. My battery power is low, so I couldn't really.
Can you use a tourniquet for people with varicose bleeding?
Yeah, that shouldn't be a problem. Yeah, the varicose won't change much of the difference. Yeah, that should be okay.
And let's see, anything else? How long can you apply pressure with your hand directly? It's straightforward.
Again,
I mean, until it stops. Yeah.
Bleeding again until it stops bleeding, or at least for 10 minutes, till you find another cloth to cover it. Yeah.
What else?
Yeah, there is. It's a good question. Can we raise the leg which has a trauma to stop bleeding? So I was thinking of putting about it. Okay, there are mentions about raising the bleeding point above the heart level to reduce the blood flow to that. But the only reason I didn't put it is because if not every patient who has a bleeding, okay, you can raise. If the person has a fracture inside, you trying to raise the leg can make things worse for him. Okay, and that's the reason I didn't put it as a general statement. Okay, but yes, if you think the person's bone is not fractured inside, if you think they can move their limb, it's only a superficial cut. Okay, and the bleeding is just from the muscle level. Okay, not gone to the bone. Then yes, it's a good thing if you raise the legs so that the blood flow to the leg is reduced. That's a good point. Yes.
Yeah. I think that's about it. Not many more questions.
Okay, great.
And most questions are repeating now.
Okay. So yeah, we are happy to take more questions on this, inshallah, through Google Classroom. Please ask us questions in the classroom. The classroom is for you, all of you, to ask questions and discuss. And we don't shy away from asking questions. Okay, the more you ask, the more you learn, and also practice these things. Go over these videos again, go the PPT again. This will be shared in your classroom. You can have a look at it and then practice it, and then you can always ask questions, inshallah.
There's one last question that's come up. Will you wear a PPE before applying pressure?
I will never say not to wear a PPE. Okay, if you have a PPE, but the question is, do you have the PPE with you all the time? Is the question. Okay, if you have a PPE, especially in our times, we have all of us are wearing masks. Okay, wherever you're going, anyways. So we'll have a mask at least. If you have a goggle to wear, okay, to avoid the blood being splashed in your eyes, you can wear that, no problem. The rest of it can be washed. If you use your hands, you can wash your hands, no problem. As long as your hands don't have a wound, okay, on which someone else's blood is falling. Your hands are not having any wound. Your skin is intact. You can use it and then you can wash your hands, no problem. Again, this is about saving someone's life, isn't it? But obviously you need to protect yourself first. If you think that you have a PPE and you can use it and then do it, then you wear it. If you don't, I think you should still go forward and help that person.
Yeah, that's correct.
Yeah. Okay, so I think if there isn't any more questions, then we'll end the session. Is it all right?
Yeah, I think we can. Yeah, I think we can stop. No more questions then.
Yeah. Okay. So with this, I'll end the question. Any more questions, we'll take it in the Google Classroom, inshallah. Subhanakallah bihamdika ashhadu an la ilaha illa anta astaghfiruka wa atubu ilaik. Okay, one last thing I forgot to mention. I think we'll have to go back to the slides. I have one last slide to show that there is the next class, inshallah, will be November 1. instead of the other date. We mentioned middle of November, but we thought we can make it a bit more earlier. So not the next week, the week after that, inshallah. November 1 will be our next class. We'll continue our discussion on head injury, on fractures, how to reduce it, burns, okay, burn injuries, drowning someone in the water, when you drown, take them out, what to do, and something called silver trauma. We'll talk about silver trauma and other topics, inshallah. And we were planning of starting something called Doc Talk, okay, and we've already have a Doc Talk program that is, some of you would have attended a program by the ophthalmologist recently, and the one before that we spoke on the COVID. So we thought we can continue a Doc Talk program. It's a very casual talk between the doctors. Again, there you can ask a lot of questions. It will be going live on YouTube, inshallah. We will let you know, we'll keep you informed when we start it. And that will be maybe a weekly or once in 2 weeks, sort of a very casual talk between doctors, explaining basic things that are happening around you. You can ask day-to-day questions, what happens in a medical condition, normal things, everything, not just trauma and life support, every basic small medical doubts. Inshallah, we'll try to talk on those things. Just a small intro on that Doc Talk. We'll give you more information on that, inshallah. Yeah, and so stay safe, keep yourself safe. Barakallah feekum, jazakallah khaira for attending today. Subhanakallah bihamdika ashhadu an la ilaha illa anta astaghfiruka wa atubu ilayk.